So human papillomavirus is another sexually transmitted disease. It's caused by a virus, though, not a bacterium. And basically, it's actually a group of viruses. They're all human papilloma, but they have different numbers. They're like, I don't know, 40, 60 that can cause disease. But the major ones cause either genital warts, or they cause warts, and our concern with respect to sexually transmitted diseases is the genital warts. And they also can cause cancer, particularly cervical cancer in women. Now, the virus that causes, the ones that cause warts aren't the same ones that cause cancer. It's kind of either or. But the problem is that we don't know, we can't do a blood test and say, oh, this is the one that you have. You don't know until you actually have a wart, and then they can do culture, they can look at the tissue, they can do like DNA probes, things like that, to see what type it is. And the same with cervical cancer. Then they can look at it and say, okay, it's, these ones cause cervical cancer and these ones cause warts. But you can't do a test to say you have the virus and you have these ones. It's basically, you know that you have the virus when you have cervical cancer or when you have warts. Basically, it's not something that you can detect until someone actually presents with a wart, or when they go for their yearly pap smear, and that's one of the ways to detect if they've had the infection. Because when you do the pap smear, you send it for pathology and you look to see if there's any abnormality in the cells. And that shows that there's active virus. But otherwise, you can't do the test. So I couldn't test someone and say, oh, you don't have any warts, the pap smear is normal, but we did detect papillomavirus, so you have to look out. We can't do that. So we basically we recommend the yearly pap smear so that you can look for cervical cancer. So basically, people who are having unprotected sex, again, I know that there's a big worry about pregnancy, but I think that the bigger worry would be a sexually transmitted disease, particularly one that you can't get rid of. And it's hard to get rid of viruses. Basically, once they're in your body, you're stuck with them. And so people who basically don't use condoms and they have intercourse or they have sexual contact with someone who has the virus, and you may see it with a man if he has the warts, but you may not see it. Sometimes the warts will grow and they'll regress, or you can get them treated and removed, but that doesn't mean that all the virus is gone. The other thing is that you don't necessarily see the virus with men if it's the one that causes cervical cancer. There is it's possible that it can cause some penile cancer, but that's not very common anyway. And for men who have intercourse with other men or have anal intercourse, there's concern that this may contribute to anal cancer. But there's still studies going on with that. But the big thing is that the women we know for sure are at risk for having significant complications from this. One other thing that people don't ever talk about, but this is actually something that I experienced, was my roommate in medical school, when she was doing a pediatric rotation, actually took care of a 4-year-old child who had warts on his vocal cords because his mother had the warts when she gave birth to him. And so when he passed through the birth canal, he was exposed to the virus when he was breathing in, and it basically settled on his vocal cords. And they were actually trying to do surgery to remove some of those warts from his vocal cords. So it's not just the person who's having unprotected sex who's at risk, it's also their future children who are at risk for having complications from this disease. For the warts, you can remove them. They can do cryotherapy with liquid nitrogen. They have different things that they can use to remove the warts, and they try to remove enough of the skin to get all of the virus, all the virally infected cells, but there's no guarantee that they can do that. The other thing is for the cancer, we do the screening to try to detect cervical cancer early so that you can treat it. There are different methods depending on the degree of what we call dysplasia or abnormal cells. There are different treatments that you do, including surgical treatments for that. So it depends on the illness and the degree of the illness, how you go about treating it. One of the problems, though, is that with cervical cancer, it's becoming more aggressive. So back maybe 20 or 30 years ago, what we saw was cervical cancer in women who were maybe 50 years old, 40, 50, 60 years old. So they were a little bit older, it wasn't as aggressive. Now what we're seeing is this cancer in 20 and 30-year-old women, and women dying from it more commonly than in the past. So I think it's a combination of them contracting the virus earlier, and of the virus maybe being a little bit more aggressive. I haven't done the research myself into all of that, but I've just read some of that, and so there are a couple things going on there. So it's not necessarily the exact same virus that it was before. So that is a concern as well. I mean, I saw, this was years ago, a 35-year-old woman dying of cervical cancer, which is just, unbelievable. So, yeah, it seems like it's a little bit more aggressive. So even though you can do some things to try to treat it, cervical cancer is a serious disease, and it does kill. About 9,700 women get diagnosed with this every year, and about 3,700 die. So we're talking more than a third who get diagnosed die. Well, that's why we do screening every year. And if it's abnormal, because if you get a Pap test every year, if it's abnormal, they follow you less than a year. They'll follow you in 2 months, 3 months, 6 months, depending on the degree of abnormality of the cells. And they remove those cells. So if you go for a Pap, then you should be able to catch it early enough.